is the approach likely to be more done at home? Tell me more about your thoughts.
Obviously, with this current surge of tens of thousands of cases, we no longer to adhere to the approach that we have been doing in the past 2 years. In the past 2 years, any positive case will be sent to the hospital for treatment. Now, clearly, we can't do that. I mean, I think when you were down to only less than teens in 20 and 30, yes, you can afford to send every single patient to the hospital. Today, absolutely not. Only those with serious illnesses, will be sent to the hospital for treatment. Most other cases, mild and symptomatic, currently, they are mostly now being isolated at home. Some of them will be sent to these isolation facility, quarantine facility, but those numbers are limited. I believe there's only less than 5,000, 6,000 of them. But with the help from the mainland, we are building these so-called CIT, community isolation facilities, in the coming weeks. But even that, we're talking about maybe 50, 60,000 of these isolation facilities. So clearly, it's still not enough. But because Hong Kong living condition is not good, many people live in very small environment. So we still need these isolation facilities, public isolation facilities. So I think the way forward is that, home isolation is for those who live in conditions which is viable for you to isolate and mild symptoms. And for those who, probably best to be put into a facility because they just can't isolate themselves at home, then we have these so-called CIT. And for those who are severely ill, they will be admitted to the hospital for treatment. So Hong Kong is an international city, and we have two sets of audience. We obviously have a local audience, the public Hong Kong people, and also that international community. Not all of them get the correct message, and also I think there is somewhat of a biased commentary from the international press. The administration has a hard time trying to explain to them, try to calm their fear. While meantime, they need to also address to the local community, which care more about public health and want to make sure that the virus would not further spread.
Hong Kong experienced a lot. Tell me more about how do you see, in retrospect, the past few years, briefly?
With the support from central government, we were able to introduce the national security law and electoral reform to put the city back in order. And that itself is already quite a traumatic event. And then follow immediately with that is obviously the pandemic. So I think back to back in the last 3 years, it has been a very trying time for Hong Kong, for not just for the government itself, but also for the Hong Kong people. But I still believe that Hong Kong being such an important part of China, is the most international city of China with one country, two systems. I have no doubt that Hong Kong will able to turn around.